Bismillahirrahmanirrahim. Today's my presentation is on PET-CT guided stereotactic gamma knife radiosurgery for recurrent and glioma tumors. PET guided radiosurgery is a stereotactic treatment defined as a delivery of a single high dose of radiation, allowing a safe and complete destruction of precise target structure. CT and MRI are commonly used imaging modalities in radiosurgery and have limitation for target delineation in infiltrative and recurrent brain tumors. Once the target volume is defined, a planned dose is composed and verified by the neurosurgeon, radiation oncologist, and medical physicist. The prescribed dose is chosen on the basis of nature of the tumor. The final target volume is defined and drawn on the stereotactic MR image with diffusion of PET-CT metabolically active images as well as anatomical location of a tumor and functional areas at risk. These are the images. I'll just quickly explain that. The yellow line shows the combination of both, and the final target is the dark blue line, which we can see is the final target most inclined towards the findings of the PET. These are another images in which the PET and CT are combined. Also the MRI. This is another case in which we did the same. In this case, the MRI and PET of recurrent glioma anaplastic transformation of previously resected and radiated grade 2 astrocytoma, intense fluorodeoxyglucose uptake corresponds to newly contrast enhancing lesion on MRI. This was a recurrent tumor. In another recurrent tumor, the patient with previously resected and radiated grade right frontal grade 2 glioma, new contrast enhancing lesion in left frontal lobe correspond to increased fluorodeoxyglucose uptake. This lesion was again resected and grade 4 tumor was found. This is another very interesting case. This patient was given PET-CT guided stereotactic gamma knife radiation in 2011, and the patient was followed for 10 years. He had a very minimal neurological deficit, and for 10 years, he remained on the same state and tumor regressed. These were the images in 2011. And this was a plan for gamma based on both mechanisms. And this was 2021 recurrent tumor. Patient just felt a bit more neurological deficit, weakness or numbness, so he came back. He was on routine checkups per year, and this was a new plan which he made, the gamma plan on which he was treated. And this was the final tumor, which was highly metabolic area, which was radiated. This is another case in which the patient initially had a tumor on the right side, which was given radiation, and after 2 years, he developed the same tumor on the left side, and again, the plan was made and radiation was given. And this in this image, we can see that MRI can only define as the glioma, but these images can show that what area is highly active and to what area the radiation should be, high dose should be given. And this all is done on 64 slice machine with Onco engine installed at Neurospinal Cancer Care Institute since 2011. The indication of PET integrated in gamma knife surgery. Stereotactic PET is used to define the actual volume and size of the target, degree of anaplasia, and prognosis in brain tumors. It improves the targeting for radiosurgically treatable lesion such as glioma, metastasis, and infiltrative primary tumors. Its role in oncology, it helps to differentiate malignant from benign. It is also able to detect the site of recurrent tumor and differentiate from radiation tissue necrosis. It helps in locating the best site for biopsy in suspected tumor. PET-CT combination is useful in monitoring the effect of the therapy. So these are the tumor which we had, high grade to low grade, and these were the locations. 7 patients presented with multiple lesions. 5 of them had abnormal uptake and 2 had no uptake in any of the lesions. Overall, we had represented mean decrease of target volume by 33%. The volume were restricted to the target volume comprised of the entire area of the PET uptake, but not the entire abnormal MRI uptake, because the later projected partially into the highly functional areas. The information obtained from stereotactic PET contributed to definition of the target volume primarily based on the area of increased PET uptake, which was shown previously. Integration of PET and neurological procedure contributes to better management of the brain tumors in targeting the aggressive and heterogeneous areas of tumor. Abnormal PET signals suitable for target corresponds to the area of increased tracer uptake compared with the surrounding brain. Limitations, lack of easy availability of PET, pregnancy and lactating mothers should avoid, and it may affect the insulin metabolism. Future impact of such therapies: it shortens the therapy, treat resistant disease early, and enhance the survival. PET-CT has revolutionized medical diagnosis in many fields by adding precision of anatomical localization to functional imaging and with high level of accuracy. So the conclusion is the integration of PET in gamma knife represents a crucial step towards the further development in neuro-onco advances, as this approach provides additional information that may open new perspectives for optimization of the treatment of brain tumors. Thank you.